Welcome to this fairly brief talk about health and wellbeing. I'm Camilla Halfort, and I look after COTA's Strength and Wellbeing programme in New South Wales. But today I'll talk about a number of easy ways to look after you. To start my talk, I want to acknowledge the traditional custodians of the land that each of us are on today and pay our respects to the way that the elders, past and present, have cared for this land. And in turn, the land has looked after us. Having a spiritual connection with our land can be very powerful. Mother Nature, after all, provides us with the food that nourishes us, the air that we breathe, and the space that we live, move, and interact with our fellow humans. I'll start to give you a bit of an overview of who COTA New South Wales is and what we do to support and improve the health and wellbeing of people 50 plus in our state. I'll talk about why looking after you is important and give you some easy ways to help improve the health and well-being. This will include enjoying your food and the nutrients that feed your body. Talk about the importance of movement, and movement is medicine, how being active with friends can be fun, and what affects our mental health and how we can start to improve it. COTA New South Wales. The Council on the Ageing is a peak organisation for people over 50. It is part of a federated organisation with COTA Australia addressing the national issues and each state COTA addressing the state-based issues, having their own CEO and board. COTA New South Wales is committed to achieve a society where older people are respected, consulted, included, represented and heard. And some of the work we're currently working on is highlighting age discrimination in the workforce, submitting pre-budget submissions, making recommendations to government with our key recommendations including increasing investment in social housing, provide a specialist older person's housing information and support service, and lowering priority age, support initiatives to increase energy efficiency in housing, develop a mature age entrepreneurship and small business startup, support the importance of COTA New South Wales tool to address businesses to employ, support and retain older workers, invest in exercise programs and alcohol awareness programs for older people, and address the digital divide by expanding the Tech Savvy Seniors program and advertising on radio and newspapers. The next area I want to talk about is looking after yourself important? Absolutely. And in the Western world, it's sadly seen as self-indulgent to be looking after our inner selves. However, it is essential for us, in turn for us to truly care for others. I've recently listened to a podcast by a Swedish man who spent 17 years of his life living as a Thai forest monk. He said that it became apparent over the time that he was there that it was particularly his fellow Westerners that struggled with liking themselves and fully being at peace with who they are, compared to their Thai counterparts who maybe didn't take themselves so seriously or maybe didn't have the same expectations of themselves in terms of who they're meant to be. There's a lot of self-help books and information, and it can be overwhelming, and maybe that's not you. But finding ways to feel better and being at peace with who we are. Let's find a few steps that we can start to explore about how we can look after ourselves. So in terms of looking after ourselves, what's important? What is the purpose of life? Is the purpose of life to look after your family? Is it having fun with friends? Is it being able to continue work either for the love of it or for money? Is it to travel or is it hobbies? As we age, we may become the matriarch or patriarch of the family, whether this is your own children or others. And this position is much more enjoyable when we have the strength, energy, and passion to contribute and be part of everyone's lives, having the energy to keep up with our peers, our grandchildren, and those around us. Life can be what we make of it. Yes, there will be some of us that have had harder lives than others, but all of us can enjoy time with our friends and family and look after ourselves. Makes it easier to stay strong and independent for longer. Travel, seeing our great big country is fascinating, and being strong and able will help us keep doing what we enjoy. Again, coming back to our Thai forest monk, who are amongst the poorest people in our world in terms of money, but some of the richest in terms of emotional freedom. There's a lot to learn for those around us. So what are some of the easy steps for better health and well-being? Taking time out for you, whether this is to meditate, go for a walk, or reading a book. Increasing physical activity and including strength and balance training. It's really important, but how can we make it fun? We'll come to that. The food we eat, once again, is incredibly important in terms of nourishing us and giving us energy. So eating lots of green vegetables, vital for fiber and vitamins, but also including protein in most of our meals. Protein is really essential, and I'll take time to look into some of the website links that I provide later in terms of how this increases with age, in terms of what we need. So how can we make cooking fun if it's not something we enjoyed very much or something we not know much about? Maybe doing a cooking course or getting together with friends to cook, share a meal, or even set up a co-op where you share food or share the times that you go to the market or the supermarket. Taking time out to stress less. Finding ways to deal with what life throws at us is a life's journey and never complete, and probably the hardest lesson. But you can find little ways to find more peace within ourselves that will go a long way. So here are some of the links that I talked about. And taking time out to enjoy our food can go a long way, but also feeling what our body's reaction is to what we eat can help us slow down and think about what we are consuming. There are several great resources provided by New South Wales Health where we can find out the recommended guidelines and what food groups and how much is recommended. The Healthy Living website, as well as the Get Healthy Information and Coaches services, are two that are worth looking up. Also looking up the Heart Foundation recipes, which are excellent and I think are well worth a look. The next area I want to talk about is movement as medicine. Our bodies are made to move, and if we don't use it, we will lose the strength and muscle mass. We are made to move, and our cardiovascular system also requires us to move for optimal circulation. I know it can be hard, particularly managing pain, fatigue, or any number of conditions, but even introducing just a small amount of extra movement every day can make a positive change to your life and to the lives of the people you care for. So it's hard as it can be. I recommend that you challenge, encourage, and salute you for putting in the effort to move more. And don't berate yourself if you ever have a bad day or week or even longer. Today is a new day. Be active with friends. Physical activity can be taken in many forms and varieties. Home-based exercises can include functional activities such as gardening, cleaning, and looking after yourself and others. But what better way than to join friends either for a walk or an exercise class? Look up a local walking group or exercise program who not only get you active, but also meeting new people. I put a number of different local opportunities. The Living Longer, Living Stronger program is in your region, as well as the Heart Foundation walking program. And Active and Healthy is a state-based database of exercise programs suitable for older adults. And lastly, the Stay Strong to Keep Moving campaign is again a coming together of organizations with suitable exercise program. So do check that out too. So Living Longer, Living Stronger is obviously my baby. This exercise program is suitable for any number of people and gives you an opportunity to meet your exercise professional prior to going into a group. If you've got referral notes from your GP or other health professionals, take those with you in for your initial consultation. You will have an opportunity to talk about your goals and your needs, anything that has stopped you from exercises previously, any concerns you have, and definitely get an opportunity to discuss how it interacts with the medication and what conditions that you're managing. Every participant have these consultations, spending at least 45 minutes talking about where you're at and where you're going, and putting together an exercise program about, again, what you need and what you want out of a strength and balance program. The last thing I want to touch on, and this is a huge area, but certainly something that we want to address. Mental health has become a buzzword in the 21st century, and with good reason. With increased stresses comes an increase in cortisol and other hormones. And taking care of your mind is just as important as eating well and being active. And there are many factors that contribute to positive mental health and well-being, including good sleep, less screen time, and reducing alcohol consumption. Find out how to take care of yourself. Have a look again on the Healthy Living website provided by New South Wales Health. Looking into all these as well in terms of how they feed into each other. It's not just one we look after, the other will interact with how we feel, both in terms of our physical and mental health. So do take time to figure out what it means to you and what you need. Listen to your body and try and get out of your mind, but at the same time, find stillness will help you in these times. So again, my name is Camilla Halford. I look after our Living Longer, Living Stronger program for COTA New South Wales. I'd love to hear from you. Hope you have a wonderful Seniors Week, and I'll speak to you again soon.